Hi, my name is Nur Bahirah Binti and my student ID is 2024267688, and I'm going to present about the mechanism of interaction between ginkgo biloba and warfarin. Next, first I will introduce briefly what is warfarin and ginkgo biloba. Warfarin. What is warfarin? Warfarin is a medicine that prevents blood clots. It was first used as a rat poison in 1948, then approved for medical use in 1954. It works by blocking vitamin K, which helps reduce clotting in the blood. Next, ginkgo biloba is a herbal product from the ginkgo tree. It is used to boost memory and improve blood flow. It contains antioxidants and has been used in traditional Chinese medicine for thousands of years. Next, interaction between warfarin and ginkgo biloba. What is the interaction? Taking both together can cause bleeding events such as bruising and even serious hemorrhage. In some cases, this can lead to life-threatening complications if not monitored. How can this happen? Ginkgo biloba can increase the risk of bleeding when taken with warfarin by enhancing its anticoagulant and antiplatelet effects. This means blood takes longer to clot, increasing bleeding risk even from minor injuries. Why can this happen? Many patients do not disclose herbal supplement use to their doctors, which increases the risk of unnoticed interaction. This is dangerous because healthcare providers might not adjust the warfarin dose or monitor INR blood clotting level closely enough. Next, mechanism of interaction. Pharmacokinetics interaction based on ADME. First, absorption. Ginkgo biloba does not significantly affect the absorption of warfarin, as warfarin bioavailability remains unchanged when taken with ginkgo. Although ginkgo biloba does not significantly change the absorption of warfarin, patients should still be cautious when taking both together, as herbal supplements such as ginkgo biloba can sometimes have unpredictable effect in certain individuals. Next, for distribution, warfarin is highly protein-bound. Flavonoid, which is one of the main active components of ginkgo biloba, also bind to proteins. However, there is no case that shown bind of ginkgo interrupted warfarin protein bind. Next is metabolism. Warfarin is metabolized mainly by liver enzyme CYP450. Ginkgo biloba contains compounds that can both inhibit and induce CYP enzyme, but there is no clinical studies have proved the effect of ginkgo on warfarin metabolism. But there is some animal studies that suggest ginkgo may induce CYP enzyme. Since ginkgo may influence liver enzyme like CYP450, it might change how fast or slow warfarin is broken down. This may either increase or decrease warfarin effect, which is why regular INR monitoring is important during co-administration. Next is the excretion. Warfarin mainly is excreted through urine in inactive metabolized form. There is no evidence that ginkgo affects warfarin excretion pathways. In summary, while ginkgo biloba does not seem to strongly alter warfarin pharmacokinetics, it still has the potential to interact through enzyme modulation. So, caution and regular monitoring are very essential when both are used together. Next, so here I conclude that the interaction between ginkgo biloba and warfarin are primarily pharmacodynamic and not pharmacokinetic, as there is no evidence that shown ginkgo biloba altering warfarin pathways. Next, for the clinical consequences, drug effects, warfarin is an anticoagulant that works by stopping vitamin K from helping make clotting factors. Ginkgo biloba reduce platelet function and blood viscosity. When these two are combined, they work through different pathways of hemostasis, but both make it harder for the blood to clot, leading to an increased risk of bleeding. Next, how warfarin affecting blood clot mechanism. Warfarin works by inhibiting the enzyme vitamin K epoxide reductase. This leads to reduced recycling of vitamin K, which is essential for activating clotting proteins. As a result, the production of active clotting factor decreases and making it harder for the body to form stable fibrin clots. Next, how ginkgo biloba affecting blood clot mechanism. Ginkgo biloba, especially its ginkgolides B, act as antagonists at the platelet activating factor receptor. This blocks platelet activation and reduce clot formation. Ginkgo also has fibrinolytic effects to help dissolve clots, and its components like biflavonoids can inhibit thrombin activity, further preventing blood clotting. Suspected health risks from warfarin and ginkgo biloba. First, increased bleeding risk. A study found a 38% higher risk of bleeding in patients that taking both medication compared to those taking warfarin alone. Second, potential for hemorrhage. Combining ginkgo with warfarin can lead to a very serious hemorrhage. Third, challenge in monitoring. Ginkgo antiplatelet effects are not detected by INR, which is used to monitor warfarin therapy. As we learned in the lesson before, therapeutic window for warfarin quite small, that is why it needs to be monitored. Hemorrhage. What is hemorrhage? Hemorrhage means heavy bleeding. This is the real case study that I used as a source for the suspected health risk and the mechanism of interaction. Side effects. People who take warfarin or ginkgo biloba may bleed more easily because their blood clotting mechanism does not work properly. This can lead to side effects like easy bruising, nosebleeds, blood in the urine or stool, gum bleeding, and prolonged bleeding from cuts or wounds. As a pharmacist, the patient is taking warfarin and ginkgo biloba. Both can increase the risk of bleeding. Hence, as a pharmacist, they should advise the patient like this. First, the patient should avoid activities that may cause injury or falls, as even minor injuries can cause significant bleeding to the patient. Second, the patient must inform their doctor or dentist that they are taking warfarin and ginkgo biloba before undergoing any medical and dental procedure. Third, the patient should monitor for signs of bleeding. Fourth, if the patient experiences serious, prolonged or uncontrolled bleeding, they should seek medical attention immediately at the nearest clinic or hospital. Fifth, the patient should attend all scheduled blood tests to monitor their clotting levels INR and ensure the medicine is working safely. Sixth, before taking any new medicine, herbal product or supplements, the patient should always consult their doctor or pharmacist to prevent the harmful interaction. As a pharmacist, they should also advise the patient on what to avoid in their diet while taking warfarin and ginkgo biloba. First, food high in vitamin K because vitamin K can reduce warfarin effect and make blood more likely to clot. Second, blood thinning food and supplements like garlic, ginger, turmeric and fish oil, as this can increase bleeding risk. Third, alcohol, since it can interfere with warfarin metabolism and raise bleeding risk. For the last one is grapefruit juice because it can affect enzymes that metabolize warfarin, potentially increase its blood thinning effect. For the last slide, I will compile all of the references that I used while researching about this topic. First page and the last page. That's all from me. Thank you.